Hi everyone, myself Dr. Vinoth. Today we're going to discuss about an interesting topic, tattooing, with my friends Dr. Arvind and Dr. Abhishek. Why we chose this topic? Mainly because the awareness regarding tattooing is very low even in the educated set of population. Recently, you might have heard about two youngsters contracted HIV infection after getting tattooed from a local shop. Today we are going to discuss about what are the changes that happen in our body after tattooing, what are the precautions you should take care before you are planning to get tattooed, then what are the complications of tattooing in this video. People get themselves tattooed. The reason might range from as small as a mere fashion trend to something more prominent to boost their willpower. The most common reason for tattooing is to show their affection towards an individual or in memory of a most lovable person. The tattooing art in our Indian culture is not new. It dates back even to 5000 years ago. Recently, tattooing has also evolved with the evolution of technologies in tattooing. In some tribes, tattooing is used as an identification mark or to boost or show their culture to others. What are the changes that happen in our body and skin after tattooing? To understand this better, we must know about the anatomy of outer skin part. So, skin is divided from outside to inside as outermost layer epidermis, and the second layer beneath it is called as dermis, and the third layer as hypodermis, are also called as subcutaneous tissue. This outermost layer epidermis, the cells are packed very tight and these cells are replaced every 4 weeks. So whatever the dye that is taken up in the epidermal layer, that will get replaced after 4 weeks. So this is the main reason there is a change in the tattoo color or the change in the tattoo contrast after 1 or 2 months. Then coming to the second layer, dermis. This is the main layer where the maximum amount of ink is taken up, and how much amount the ink is taken up in the dermis, this will decide the longevity of the tattooing. So what happens here? See, once the dye is injected into the dermis by the needle, this induce an inflammation. So what is inflammation? Inflammation means the process by which chemical reactions are activated, and this will invite multiple white blood cells, especially macrophages, into the site of inflammation. So what these macrophages do? So these macrophages not only taken the infective organism as a threat, they will also take the foreign materials as threat. So these macrophages try to eat or they will ingest these pigments of dye into them. So this process is called as phagocytosis. But these dyes are not biodegradable. So these macrophages cannot digest it. So they will take these dye pigments within them, and ultimately once their lifespan of 1 or 2 years is done, they will release the dye into the subcutaneous tissue or into the loose connective tissue. So this dye will be taken up by a new macrophage and this cycle continues. So this will decide how long the tattoo will be there. So the longevity of the tattoo depends upon the macrophage uptake and release and how much amount of dye is retained in the dermal layer. And the third layer is called as hypodermis or subcutaneous tissue. This layer is mainly made up of adipose tissue or fat. So it is similarly like a oily layer. So whenever the dye is injected here, as we all know, what happens if we add a pigment or a dye to an oily layer, it will spread. So similarly, if the needle unknowingly injected into the hypodermal layer, there will be fading of the dye. So this is the reason for blurring of tattoo, or also called as blown out feature of the tattoo. So the hypodermal layer should not be pierced while tattooing.
So let us briefly discuss about the complications related to tattooing. The most common complication after tattooing which a person can see is acute local inflammation that is caused by superficial infective agents like streptococcus and staphylococcus. Other procedure related complications are commonly seen like pain, which again depends on the tolerance of person, which varies from individual to individual. There could be minor bleeding as well, which can be seen after tattooing, redness and local swelling. Other complications like allergic dermatitis can be seen. So these are the most commonly seen local complications. Coming to the systemic complications after tattooing. Even though most of the pigment and ink used in tattooing gets retained in the skin, some of the amount can get escaped into the lymphatic circulation, which can cause to lymph node enlargement and liver related issues. This is due to the metal and plastic content of the tattoo ink and the pigment. There are some other rare but dreadful complications like HIV, HBV, HCV infections. HIV again infection depends on the amount of viral load, the amount of bleeding. If the bleeding is more in the process of tattooing, if the viral load is more, and if the amount of the retained blood inside the needle is more, or if the equipments are not properly sterilized, can cause to such complications. Complications after tattooing again depends on the type of ink which is used. For instance, black ink if used can cause the least amount of complications and is most commonly used. On the other hand, red ink is prone for the most long-term complications. There is one more rare complication after tattooing. If a person with a tattoo wants to get an MRI done, he might have post-MRI redness and swelling of the local region.
One more add-on point regarding tattooing are just a myth breaker whether persons with tattoos are allowed to appear for UPSC exams. There is no definite rule or restriction regarding tattooing for UPSC examination, but it is better to avoid tattoos in your exposed areas if you are planning for UPSC examination. Many times my non-medical friends ask, if there is no problem with tattooing, why you didn't do it? Because I didn't have any passion for it, but I know a person who is more passionate about tattooing. I have my friend Dr. Abhishek who had done multiple tattoos in his body. So he will explain about precautions you need to take care before tattooing.
Now before talking about all the precautions, I'll show you a few tattoos that I've got on my body. So this is the first tattoo that I got in my college first year. This tattoo depicts my dog, Bella, and there are a few other tattoos that I have on my knuckles. Now I'll be talking about what are the precautions you should keep in mind before getting a tattoo. First and foremost important thing is that the tattoo artist should be properly trained from a professional institute. Secondly, the tattoo parlor should be in a clean and hygienic condition. The third point being the tattoo artist should wash his hand and use fresh pair of gloves every time before doing a tattoo. Secondly, he should sterilize all the non-disposable items like his tattoo gun. He should make sure the working area is disinfected after each session. Fourth point, make sure the tattoo artist uses fresh pigments. The old pigments in the pigment tray should be discarded as it might contain previous customers' blood from the needle. Post-tattoo care is equally important as the precautions because the post-tattoo care decides the longevity of the tattoo. Now coming to the post-tattoo cares, you should clean your tattooed area with mild soap and water, should not use any irritants. Secondly, you should avoid going to swimming pools and hot tubs for at least 2 weeks after getting the tattoo. You should avoid direct sun exposure to the tattooed area because the UV rays can cause harm to the tattooed area. Fourth point, avoid wearing tight fitting clothes that might irritate the tattooed area. And then lastly, don't ever pick scab of the tattooed area as it might cause scarring of the tattoo and disfigurement of the tattoo.
I hope this video have cleared many doubts regarding tattooing, and it also proved that if done properly with proper precaution, the chance of health risk post tattooing is very less. So what do you think, Dr. Arvind? Will you get tattooed in future?
Yeah, definitely, why not? See, I have the small dream of getting a tattoo someday, a small little tattoo or my wrist or somewhere else. Maybe that will make me somewhat cool as compared to Dr. Abhishek over here.
I hope this video is useful. Do like and share.